Hi, I'm Cheryl Atkinson. Welcome to Washington Unplugged. Former President Lyndon B. Johnson passed Medicare legislation in just a little more than 6 months from his inauguration. While his party held both houses in Congress, much like today, many felt his inside negotiations and political savvy sealed the deal. We'll have a discussion about how President Obama's health care cause could benefit from lessons of the president's past. But first, listen how recordings of LBJ tell the story of Medicare legislation.
I will faithfully execute.
It was 1965. President Johnson had been elected in a landslide. He made Medicare, hospital coverage for the elderly, a top priority.
I'll spend the goddamn money. I may cut back some tanks, but not on health.
Johnson pushed Medicare and Medicaid like his life depended on it. He said that when John Kennedy died, it was up to him to make Kennedy a martyr. And the causes he picked for the martyred president are civil rights, Medicare, and Medicaid.
Like today, Democrats held a majority in Congress, yet sweeping national health care was far from assured. One of Medicare's toughest opponents was conservative Southern Democrat Wilbur Mills, who fretted about the cost and idea of socializing medicine. It was Mills who led the powerful committee that controlled the fate of any Medicare bill, and Mills who'd blocked Kennedy's Medicare efforts. He didn't hesitate to raise the issue of cost with President Johnson.
The only thing I'm concerned about, and I'm very frank about it, is that there's about $450 million in this bill out of the general funds of the Treasury for which you haven't budgeted your situation. Yeah, but I'll take care of that. I'll do that.
Johnson prodded Mills relentlessly and finally won his support, offering, then giving him full credit.
I want to ask Chairman Mills now to make a brief statement concerning this program that his committee's worked out.
Johnson knew he also had to woo conservative Democrats in the Senate, led by Dick Russell. In a phone call with newly elected Senator Ted Kennedy, Johnson told Kennedy it was important to control the message on cost, lest Senator Russell find out.
My health program yesterday runs $300 million, but the fools had to go to projecting it down the road 5 or 6 years. And when you project it the first year, it runs $900 million. But the first thing Dick Russell comes running in and say, my God, you've got $1 billion program for next year on health, therefore I'm against any of it now. Do you follow me?
Right.
Now, we don't want to stir up any more hornets than we have to.
He thought that if people knew the full cost of Medicare, it would never have passed. And he kept trying to lowball the estimates.
There was powerful opposition outside of Congress, too, some of which was viewed as inevitable by the president and his key aide on Medicare.
What are the insurance companies? They still raising hell mad?
Yes, I think they're going to go over to the Senate and raise hell on the thing, because quite frankly, there's no longer any room for the private insurance companies to sell insurance policies for people over 65 when you take the combination of hospital care and the physician service.
Yeah, okay. I think that's wonderful.
With Johnson's near-daily involvement from start to finish, Medicare was passed and signed into law a little more than 6 months after his inauguration, July 30th, 1965. And by the way, the expert we heard from in that story was James Marone, Brown University health politics professor. I'm joined now on the phone by presidential historian and senior fellow at the Brookings Institute, Stephen Hess, as well as Newsweek contributing editor Eleanor Clift to discuss all of this. In an article you wrote, Eleanor, you said, if President Obama is to succeed on his health care reform push, he must persuade individual members of Congress, working them over like a modern-day LBJ, cajoling, begging, bullying, doing whatever it takes. Would that strategy work for him today? He has a very different personality, doesn't he?
Well, he has a different personality. He likes to be above the battle. And in fairness, President Johnson was the Senate majority leader, so he knew, before he came to the White House, so he knew sort of the sweet spot of every senator. And in that article that you referenced, I recall through an advisor who worked for President Johnson, Harry McPherson, he said that President Johnson would use flattery, and he got the Republican minority leader at the time, Everett Dirksen's support on a civil rights bill by suggesting that he might be honored in the town square of his hometown in Illinois along with Abraham Lincoln. So he was very good at flattery, and he was good at bullying as well. But one thing that isn't mentioned in your piece, he also had 67 Democrats in the Senate, which is a lot more than the 60 that President Obama has, and still hard.
A lot of the opposition, the firmest people he had to bring over were some conservative Democrats on his own side. Are there parallels to that today?
Yes, I mean, President Johnson could do it alone without Republicans, and so can President Obama. And so the force of personality does come into play. And again, to quote Johnson, you have to deal with Congress relentlessly and continuously. And I think that the strategy that this White House has employed has been basically to let Congress do its own thing. And I think now it's time that President Obama is going to have to win over Democrats one by one.
All right, Stephen Hess, first, what's your background in just a nutshell, please, and what is the Brookings Institute?
Oh, my goodness. I was around in the Senate as an assistant to the Republican whip back in 1961, and was on the Eisenhower staff, President Eisenhower's staff as a speechwriter as well. So I do remember Lyndon Johnson, and I can assure you, and your piece is a very, very accurate and persuasive piece about Lyndon Johnson as the master. I mean, he was a maestro. He knew every senator and where they had buried the treasure, and he knew how to dig it up. And there really is no way of duplicating a Lyndon Johnson today. He was the president of the United States who knew the Senate and the Congress better than any other president in American history.
Well,
so I agree with Eleanor entirely. It would be lovely to have somebody else who had that capacity to twist arms when that's necessary. But there ain't no Lyndon Johnson around.
All right. Well, Mr. Hess, from what you know, though, can President Obama borrow a page or a bit of that style? What do you think?
Well, I think he's got to be a little tougher, and I think that's all there in the script, if you will. I mean, we're reaching the point where something is going to be passed. And something is going to have to be bargained, and this is sausage-making time. And he's got folks in the White House staff, Rahm Emanuel particularly, who are very good at this. So my guess would be, not in the predicting game, is that there will be a piece of legislation that comes out of this Congress. And it's not going to be quite the way that this president wants it to be, but I hope it's sufficient for him to sign it and to claim victory. And at this point, it is exactly as Eleanor phrased it, a time when you really do have to do some squeezing and some pushing and some cajoling and maybe a little flattery too.
All right, Eleanor, knowing what you know, who are those people that the president ought to be having those LBJ-like conversations with in the House and in the Senate? Can you give me a couple of names of the most important ones?
Well, in the House, you've got the Blue Dogs, and they are basically the swing group there. And in the Senate, it's I think 17 centrist Democrats that he had to the White House last week who were nervous. Many of them are from red states. And it's the members of Congress who are from districts that John McCain carried, who are worried about their own reelection prospects. And I went to a briefing this morning with Senator Bob Dole and Senator Daschle, and it was Senator Dole who said, this is about survival. The members of Congress like it here. They don't want to pack. They've got to be reassured that this is going to be a popular enough measure that they're not putting their own reelection on the line. We like to think everybody acts in the national interest, but it really does come down to each individual member and what they need legislatively. And the deals went on with Johnson. I don't think they were exposed. There was no cable TV then. And I think this president is dealing with a much more transparent media climate, and also the Congressional Budget Office, which is scoring this bill as far more than Americans want to pay for it.
LBJ was able to give his own predictions and not have them second guessed.
Exactly.
I want to play one more excerpt. that I thought was just fun and fascinating with LBJ discussing with his legislative assistant secretary Wilbert Cohen, who later became known as sort of the father of Medicare. He's explaining to the president how physician services would be rolled into Medicare coverage, because originally it was just supposed to be hospital services, but to get it passed, they rolled in physician services as well. And listen to the president talk the night before this bill was about to be introduced, as he's getting briefed on exactly what that means.
Well, generally speaking, it's physician services.
Physicians?
Yes, in the office.
All right, now my doctor that I go out and he pumps my stomach out to see if I got any ulcers, that physician?
That's right.
All right, any medical services that are MD services?
Any MD services. Now,
all right, now how do we know, what does he charge, what he wants to?
No, he can't quite charge what he wants to because this has been put in a separate fund.
Yeah.
And what the Secretary of HEW would have to do is make some kind of agreement with somebody like Blue Shield,
yeah,
let's say, and it would be their responsibility, under the way the chairman has provided the bill, that they would regulate the fees of, in effect, of the doctor. Because what he tried to do is to be sure that the government wasn't regulating the fees directly. It didn't deal with the individual doctor. And the bill provides that the doctor could only charge the reasonable charges, but this intermediary, the Blue Shield, would have to do all the policing so that the government wouldn't have its long hands.
All right, that's good. Now, what does it do for you, the patient, on doctors? It says that you can have doctors' bills paid up to what extent, or how much, or any limit?
The individual patient has to pay the first $50 deductible, and then he's got to pay 20%.
Of everything after that?
Everything after that. So that if you went to the doctor and you had a $1,000 bill, you'd pay the first $50, and then for the other $950, you'd have to pay 20% of that.
But that keeps you hypochondriacs out.
That keeps the hypochondriacs out. At the same time, for most of the people, it would provide an overwhelming proportion of their physician's cost.
Yes, sir, and it's something that nearly everybody could endure. They could borrow that much, or their folks could get them that much to pay their part.
That was the birth of Medicare as we know it today. Fascinating discussions. Thanks so much, Stephen Hess, for joining us, and also thank you, Eleanor Clift, for your insights. We appreciate it so much. And thanks to you for watching Washington Unplugged. Find us here every day at 12:30 p.m. on CBSNews.com. I'm Cheryl Atkinson. You can watch my Follow the Money reports on the CBS Evening News with Katie Couric. Tonight, I'll report on Congressman Charles Rangel's troubles, including the hundreds of thousands of dollars in assets he left off his financial disclosures.